Hello, my name is Stephen Sprules, and I will be talking about postmortem staining and its effect on embalming. This is mrts1225. Mr. B. Smith is our professor at Northeast Texas Community College, Mount Pleasant, Texas, spring 2025, due April the 7th. Postmortem staining is known by several names: vabiasis, darkening of death, sagillation, postmortem hypostasis, postmortem lividity. There are so many names that is attached to it. What it is simply is the process of the blood accumulating in the lowest part of the body due to gravity mainly. It discolors the skin. The skin can be discolored from a hue of colors from red to a deep dark purplish effect. That staining can become fixed. That staining can be non-fixed. It is dependent upon the amount of time that the body has actually been laying there, and the pooling and the staining has occurred and taken place. If you look in this slide presentation, you find that places of postmortem staining are dependent, as we said, upon the gravity. If you look at the top picture, we see the supine position where the body laying on its back. Of course, gravity wise, the back is the closest to the floor, so the blood would pool down. If you look at the middle picture, you see that the prone position where it's face down, then you will see more pooling and staining, more lividity there in the face area and on the front of the bodies. If they have fallen or had been laid on their side, as in the third diagram, you will see where the actual point of gravity is, and there are some little markers there to kind of help show you where that deepest place or the most pull on the gravity would be associated. Postmortem staining, lividity, does not have to be complete solid in its coverage. Depending on items that were attached to the person, belts, ties, bandages, clothing, shoes, cuffs, straps, ropes, anything like that can also play a part in where that staining is heavier than other places, or if it's there or not. The problem with it, postmortem staining, it adds a element in the embalming process that the embalmers must treat face clearly and squarely and deal with, so that they can get the best penetration and flow for the embalming fluids to go through, so that there can be complete coverage in the embalming process, and also so that those chemicals can have the best opportunity to try to dissolve the staining, eradicate it as much as possible, so that that staining can be eliminated, or it at least can be dealt with in the cosmetic end and it can be covered. When we talk about postmortem staining and the embalmer, that postmortem staining is very important, not only to the embalmer, but to the medical examiner or those others that are trying to get a description, a cause of death, because there are factors that it will play. It can help estimate the time of death. There are so many books and there are so many items and articles out from notable colleges and professors, specialists, schools, scientific labs about estimating the time of death because of staining and knowing how long a person has been laying there or had been dead. When we talk about death and we talk about estimating the time of death, there are different stages that happen. And you see here that there are so many that you can look from liver mortis, rigor mortis, body temperature stages, stomach contents, so forth and so on, or persons that can say what happened. All of those factors can be used singularly or in conjunction with one or more to come up with an estimated time of death. It's very important, as tragic and horrific as it may appear, the postmortem staining plays a very intricate part in estimating the time of death and the cause of death as well. In the early stages of liver mortis or postmortem staining, it can blanch the skin, can cause different situations to occur that will have to be intricately dealt with by the embalmer. Postmortem staining is not for a novice embalmer. It is for one that has had experience. It is for an embalmer that is well acquainted with the chemicals they use and will be using, the chemicals that should be used to help eradicate, eliminate, dissolve, get rid of the staining process. Not only can you see postmortem staining visibly from the outside, the back, the hands, the face, the feet, but the question is asked, can internal organs be stained as well? And the answer is simply yes. When we're talking about embalming and taking care of the postmortem staining, there are several companies, there are several chemicals that can be used to address this issue. It is dependent upon what chemical company, what chemical the embalmer is most familiar and comfortable with. Whether you use, of course, there are major companies, Pierce, Bondol, Frigid, so many others that one can use in addressing. What I would say is whatever chemical company or brand the embalmer is used to, have been trained on, most efficient and proficient with, they should make sure that they know what chemicals they need to address hard and difficult cases, especially if there's going to be public viewing. If they're staining in the face, the hands, the feet, they need to be well versed with the chemicals so that they can adequately and properly address. We have some chemicals here. These are hard chemicals for hard cases. There are several methods to employ confronting postmortem staining. Again, it is dependent upon your knowledge, your ability, and your comfortability with the chemicals you're using so that you can adequately address the issue. Thank you.